reactions focusing on type 1 hypersensitivity, which is the root mechanism behind anaphylaxis. Let's begin with the Gell-Coombs classification.
The Gell-Coombs system classifies the hypersensitivity reactions into four types, which are based on the immune mechanism that's involved. Remember that each type has its own unique immunopathology, triggers, and clinical examples. Type 1 is the immediate hypersensitivity, which is also known as anaphylaxis. It is mediated by IgE antibodies. Examples of type 1 hypersensitivity reactions include allergies from the peanuts and bee stings, the allergic rhinitis, the bronchial asthma, and the urticaria. All of these are the examples of type 1 hypersensitivity reaction. The type 2 hypersensitivity reactions include the hemolytic anemia, the Goodpasture syndrome, and the hemolytic disease of the newborn. Whereas the examples of the type 3 hypersensitivity reactions involve serum sickness, the systemic lupus erythematosus, and the post-streptococcus glomerulonephritis. And the type 4 hypersensitivity reactions examples include the tuberculin skin test, the contact dermatitis, and the graft versus host disease. Now the type 1 hypersensitivity reaction, which is also known as anaphylaxis, in some more detail. So it's an immediate hypersensitivity reaction. It is mediated by IgE antibodies and it would develop rapidly within seconds to minutes after the exposure to the allergens. And the key cells which would be involved in type 1 hypersensitivity reaction are mast cells and the basophils. The pathogenesis of the anaphylactic shock include the initial sensitization, which would be the first exposure to the allergen, which stimulate the B cells to produce allergen-specific IgE antibodies. Now, these IgE antibodies would bind to the FCERI receptors, which are present on the mast cells and the basophils, and they would sensitize them. Now, the re-exposure to the allergen would result in cross-linking. Upon the re-exposure, the allergen would cross-link to the IgE on the mast cells and would trigger the degranulation of the mast cells. The next step is the mediator release. Massive release of the histamine, leukotrienes, prostaglandins, and the cytokines would occur in the system. And the last effect is systemic effect, which is these mediators will cause vasodilation in the body. They would cause increased vascular permeability. They would cause the bronchoconstriction and hypotension, which will lead to the anaphylactic shock in the body. A quick clinical memory aid. The type 1 hypersensitivity reaction is the immediate hypersensitivity reaction and is mediated by the IgE antibodies. Whereas the type 2 hypersensitivity reaction is IgG or IgM directed against the cells. The type 3 hypersensitivity reaction involves the immune complexes in which there are three things. There is antigen, there is antibody, and there is a complement system. Whereas the type 4 hypersensitivity reaction is T cell mediated type of hypersensitivity, but it is time delayed. In emergencies, this understanding will speed up your recognition and the treatment procedures. Now to summarize all of this, the anaphylaxis is a type 1 hypersensitivity reaction. It is IgE mediated reaction which occurs immediately and it involves the mast cell degranulation. The differentiating hypersensitivity types is crucial for the accurate diagnosis and the management of the cases of anaphylactic shock. In the next chapter, we will move on to the clinical features and the diagnosis of the anaphylaxis. So stay with me. We have some active recall MCQs for this chapter. The question number 1 is, which immunoglobulin mediates the type 1 hypersensitivity reaction, which is also known as the anaphylactic reaction or the immediate hypersensitivity reaction? The options are IgA antibodies, IgG antibodies, IgE antibodies, and the IgM antibodies. And yes, the answer is IgE antibodies. The second question is, which of the following is a type of type 2 hypersensitivity reaction? And the options are anaphylaxis, the hemolytic anemia, the serum sickness, and the contact dermatitis. Now, if you recall, the anaphylaxis is type 1 hypersensitivity reaction, whereas the hemolytic anemia is type 2 hypersensitivity reaction. So the correct option is the answer B, which is hemolytic anemia. The next question is, in type 3 hypersensitivity, tissue damage is caused by which of the following factors? And the options are option A, in which there is mast cell degranulation, option B, which is immune complex deposition, option C, which is cytotoxic T cell activity, and option D, eosinophilic infiltration. And the answer is immune complex deposition. Now, if you recall correctly, the anaphylaxis involves the mast cell degranulation and it is a type 1 hypersensitivity reaction. Whereas the type 3 hypersensitivity reaction includes the tissue damage and it involves the immune complex deposition. Another question from this topic could be, what is the typical onset time of type 1 hypersensitivity reaction? And the options are the option A, which is immediate, it means it would develop from seconds to minutes. Option B, 6 to 12 hours. Option C, 24 to 48 hours. And option D is more than 72 hours. And the answer is immediate hypersensitivity reaction, which is also known as anaphylaxis. It would develop in seconds to minutes. Another question from this topic could be, which hypersensitivity type is exemplified by the contact dermatitis? And the options are type 1, type 2, type 3 and type 4. And yes, the answer is type 4. The type 1 hypersensitivity reaction is known as anaphylaxis and it would involve allergies from the peanuts, bee stings. It would also involve allergic rhinitis, etc. And that's it from our side. We will see you in the next chapter.